within the context of a set of global education goals that you may or may not be familiar with, but which in fact all 164 countries signed up to in the year 2000, the so-called Education for All goals, including the United States. And you see that the first one there actually is all about early childhood care and education. So the United States signed up to this actually, interestingly, in two ways. One, we should do this in the United States. Two, you see at the bottom, we should try to help developing countries if they need some financing for this. So there's two, as it were, US angles on that. One of the key lessons, and you've heard this, I think, in different ways already today, is the need to take a comprehensive approach. Yes, it's useful to do preschool. Yes, it's useful to do nutrition. But putting these together in a package is much, much more useful and much, much more effective and cost-effective. This appears to hold in almost every country where there is evidence. You've also heard, and I gather he spoke here last year, about Jim Heckman's, the Nobel Prize winner, his very profound work. And one of the interesting things about the early childhood findings is that most countries around the world are using results from the United States, possibly in some cases more than they are being used in the United States. But a new thing which is becoming interesting is that we are getting now results from many countries. I haven't included here European ones, but there are results from Europe. There are also results from several important developing countries, some of which are listed here, and they show exactly the same thing. The returns on investment will not be exactly the same, naturally, but they're all extremely high, typically well above 10%, 10 to 1, which is an extraordinary benefit-cost ratio for almost any investment, as the previous speaker indicated. And the other thing which we find around the world is that the returns are, of course, high for all children, but they are particularly high. In relative terms, they are the highest for the poorest and the most disadvantaged. This is a universal finding so far. What's going on? We divided the global situation into two analytical categories: programs for children under 3 and programs for those 3 and above. The latter, of course, being mainly about preschool, about kindergarten. Unfortunately, we can't get data globally for who's taking part in programs for under 3s, but we can get data on do these programs exist. And you see that while these basically exist in almost all countries, or in almost all developed countries, and also interestingly in Central Asia, in most parts of the developing world, fewer than half the countries actually have even one formal program for the under 3s. Quite a worrying point from the point of view of the world as a whole. What about preschool or kindergarten? Dramatic. A threefold increase over 30 years. Globally now, 1 in 3 children are enrolled in pre-primary schools. Particularly, of course, in developed countries, but look how Latin America is catching up very, very fast. Look, although the level is still quite low, how South Asia is been accelerating very rapidly recently. But also see how there's a huge way to go in most of the developing world, particularly in Africa and in the Middle East. This is not in our report, but it came from a recent UNICEF report that you may have read about. It came out about 3 weeks ago, which is actually just about OECD countries. And it just ranks child well-being. Now, of course, this is these are averages, and one has to be very careful about that. And these data are also, of course, there are many methodological issues around them. But I thought it would be interesting for you to see that of these basically OECD countries, the US and also the country I come from, Britain, are unfortunately basically towards the bottom on most of the rankings. Though interestingly, the US is not so low on the education ranking, where it's more in the middle. So far I've been talking about types of programs and how countries are doing. Now, who's actually taking part in these programs? which we've seen are most benefit the poor. Those who are taking part, unfortunately, from the point of view of benefits, are most likely to be the rich. And we also see some factors in developing world which I didn't realize applied here until I heard some questions about documentation, for example, that sometimes children can't go to take part in one of these programs because they don't have something like a birth certificate. Well, I didn't realize that applied here, but that certainly applies in many developing countries. And there are other factors also. Why is it, if these benefits are so clear, and they are clear, why is it that so few countries around the world, particularly developing ones, have not yet adopted serious policies in this area? Well, we've studied this a lot, and we found out a lot of different reasons, and I wouldn't try to say that they all apply, obviously, in every case. But what I found interesting about them is that many of these I've heard in different ways today. And so there's clearly something about several of these. Slow response to social and economic trends, such as, for example, the role of women in the workforce, or more generally, globalization. While we can all argue about what the overall effects of globalization are, the evidence seems extremely clear that within countries, even if the average level of income may be rising, the inequality is also increasing. So there is this important issue that the very poor are getting relatively poorest, even if they may be getting absolutely a little bit better off. So it's a very complex issue, but inequality is certainly on the increase, and many countries have not yet adapted to that. There's the issue we've heard about the role of the family versus the role of the government, nanny state and all of that. There's the whole complexity of the sector. Who's in charge? There's the fact that the results are not well known, particularly in developing countries, but apparently not all that well known here. There's the fact that governments in developing countries have typically prioritized primary education. Here perhaps it's more of education, but perhaps still not fully preschool education, and so on. I'll just make 3 points that we came out with which seem to apply very generally. One is the need for top-level political endorsement. It was so interesting to hear all this discussion about getting presidential candidates, questioning them, and so on. We've seen some very interesting examples around the world when a president or equivalent takes this issue on. The most recent being President Bachelet in Chile, who has really been pushing this very hard. And it's extremely interesting when you see a particular political leader decide to make that the issue or one of the key issues. There are various other aspects which we don't really have time to go into. You have in your folder, I think, a CD of our report if you're interested. And if you would like a hard copy, you can always ask us for it. A second key thing, which I just want to stress, question about quality. What makes for a quality program? Because obviously it's no good just supplying a program if it isn't a good one. Well, the key determinant appears to be not the facilities, important though those are, not the materials available for the children to play or learn with, but in fact it's the relationship between those looking after the children, the carers and the children. And this raises a lot of very important things about the need to have those people well trained and also well looked after in terms of incentives, remuneration, ongoing training and things of this type. Third key lesson, financing, and I hear a lot about this here also. If you have limited resources, what do you do? If you have limited public resources, what do you do? Do you go for a universal policy, which means you won't probably be able to get all the children, or do you go for some sort of targeted policy, and if you're going to target it, how do you target it? And there are various ways which may be more or less relevant according to the particular country. Finally, just because the United States is also, of course, has a foreign aid program, although we couldn't actually get data on the U.S., but I just want to point out that generally speaking, for those as part of countries' foreign policies or foreign aid policies, very few give particular attention to early childhood. Ones you would expect, like UNICEF, and ones you might not expect, like Finland, but most of the major countries, rich countries in the world, don't give much attention to this area. So I would like to stop there. To show that I was also listening this morning, maybe I could just conclude by saying that early childhood care and education is not a Republican issue. It's not a democratic issue. It is an American issue, but it is also a global issue.